Good afternoon, everybody. So I'm Melissa, I'm Service Manager for the North Lanarkshire Crisis Outreach Service, and I feel quite privileged standing up here because I've listened to a lot of stuff this morning that really kind of connects with what I'm going to present to you about and the unique commissioned approach that we've taken across North Lanarkshire. In particular, thank you, Rab, for mentioning Airdrie in the panel earlier, because I kind of quietly chuckled when I was sitting and we had quite a nice discussion. Also, Audit Scotland have mentioned some really interesting points in their report, and I hope that that's kind of highlighted through the work that we've commissioned in North Lanarkshire. So just to kind of talk about the service initially, the service is made up of 3 parts. So the service is an assertive outreach. We all kind of use that term across health and social care, if you will, but for us, what that looks like is we will meet people where they're at. We'll give them the choice that they require around about their support. We'll go to their own home, we'll go and meet them in their own space at their pace as well. The service is also a non-fatal overdose response, so we'll respond to individuals within 24 to 48 hours of them having a near-fatal overdose, and we'll provide them support around about that. And probably the most unique part of the service is the housing crisis response. So that's a partnership between North Lanarkshire Alcohol and Drugs Partnership and our North Lanarkshire Council housing colleagues, and that's been placed in the commissioning of the service. So the housing colleagues had monies around about the rapid rehousing plan, and they wanted to put that into a service, if you will. North Lanarkshire ADP also had monies, and they wanted to commission a service, but alone that wasn't enough, so they worked together bravely to commission the service that we are now delivering. So if I kind of talk about how we got here, so Turning Point Scotland, along with the Scottish Drugs Death Task Force and Simon Community Scotland, were delivering the overdose response. So this was a pan-Lanarkshire response and had an outreach model within it. The really unique part of the service was that it was out of hours, it was a response to referrals coming in, and the team were able to get out to people kind of 7 days a week when other services were shut. So that was the model that really worked. We've seen that people connected with that, seeing somebody, chatting somebody's door at 8 o'clock on a Friday night. Sometimes they were like, oh, yous are still working at this time. And that was one of the parts of the service that really worked well. So we wanted to integrate that into the crisis outreach service. Just to talk about some of the kind of findings from the overdose response. So Turning Point Scotland commissioned the Indigo House report in May 2022, and that really looked at all of the work that was done across the overdose response. And I think for me, certainly, the overdose response teams saved lives, and it really worked hard to work with people around about what they required in terms of their alcohol and drug needs. Oh, sorry. So I suppose touching on the overdose response did save lives, I think it's really important to also mention that we are aware that people are still dying from alcohol and drug-related deaths. So the graph that you see on the screen is the North Lanarkshire reported drug-related deaths in comparison from 2022 to 2023, and it breaks it down in terms of locality areas. So I suppose just to mention, North Lanarkshire in 2023 lost the lives of 103 people, which was a 58% increase from 2022. And I think alongside the team, we really recognise that they're people and they require our support every single day when we're out providing that. Probably just to highlight the largest, if you will. So Airdrie and Motherwell were the highest drug-related death numbers across North Lanarkshire in 2023. And also just to note, Coatbridge was the highest in terms of alcohol-related death as well. Okay. So Turning Point Scotland is really lucky to have a clinical care and governance model. Therefore, we were able to implement a senior nurse within the team within the North Lanarkshire Crisis Outreach. So Heather is here today with us, so if you have any questions around about the health element of the service, she would be able to answer that. But just to kind of cover, health for us is an integral part of what we do. So we really offer a health and social care model in all of the practices that we operate. In particular, we're kind of talking at the break about some of the things that Heather's been involved in, and Heather will outreach with the team, but also she's able to provide that clinical care when somebody requires it. So she's able to triage and direct people in terms of the help that they require, but also provide that health support and connect people to the services that they require as well. So for our housing colleagues, this was a really unique and innovative approach, and having health kind of within the model was really attractive as well in terms of what we could deliver. Oh, sorry. So I think just kind of touching around about housing, for us, there is a housing bill that's going to be released shortly, and our colleagues are going to be placing kind of duties upon all services to ask and act. So for our service, we're already doing that. We have that connection and that communication with housing colleagues, and we're able to access housing needs for individuals who have alcohol and other drug support needs. So we're already kind of, I suppose, one step ahead of that, and we're able to present our findings around about that and how the communication's working really well. We've heard this morning about kind of communication being a barrier at times, and the service isn't without its challenges, of course. However, housing and the ADP working together has really helped us to break down some of those barriers and help us to share information effectively so that the person's getting the right service. So I think just to kind of round up what I'm saying, we're then going to hear from two of the commissioners. So we're first going to hear from our North Lanarkshire Council Commissioner, and then we're going to hear from our ADP Commissioner. I think for me it's quite clear that if these three parts had been kind of commissioned individually, the service wouldn't be as great as it is. And together we were able to kind of provide the service that we're now delivering, and we have been for a year. So I'm going to play a video first of all from Margaret Kelly. So Margaret Kelly is the Business Development Manager from North Lanarkshire Council.
So my name's Margaret Kelly. I'm a Business Strategy Manager within the Council's Housing Service, and I've been working in partnership with North Lanarkshire's Drug and Alcohol Partnership and also Turning Point Scotland to deliver the crisis response service in North Lanarkshire across all of our localities. So for us, the crisis response service was part of our Rapid Rehousing Transition Plan, which is our main overarching plan for addressing homelessness in North Lanarkshire. It's been up and running now for just under a year, just launched last November, and it's made a huge impact in terms of improving tenancy sustainment, but also specifically in terms of preventing homelessness from occurring in the first instance. For us, we've seen a huge beneficial impact in terms of providing that immediate response, particularly for individuals who present as homeless out of hours, and also for people who present as homeless on a recurring or repeated basis. It's also been hugely beneficial in terms of our supported accommodation units, in terms of providing support to people at heightened times of vulnerability, to de-escalate situations and to help people maintain their accommodation. For us, it's been fundamental in terms of really preventing homelessness in North Lanarkshire and a key part of our homelessness action plan going forward. Going forward into the next few years, the new housing bill will bring in new homelessness prevention duties, and for us this is a fundamental part of our approach in North Lanarkshire in terms of eradicating homelessness. We know in terms of homelessness that most often it's a secondary cause of unmet social and healthcare issues, and for us, as all the local authorities across Scotland just now, homelessness is a key priority, with 12 local authorities declaring housing emergencies and a national declaration. For us, the approach and the interventions that the crisis response service provides is absolutely crucial as a key way forward for us to work together in partnership to address needs and to support people in terms of their wider life outcomes.
Okay, so I think what's quite clear there from what Margaret's saying is that kind of having that response within housing and really having that partnership there and being able to do some of that work, and in particular, as Margaret mentioned, out of hours and the crisis response as well. So I'm now going to play a video from John Holleran. So John Holleran is the lead commissioner for the North Lanarkshire Alcohol and Drugs Partnership. Go.
My name's John Holleran. I'm the Strategic Lead for North Lanarkshire Alcohol and Drugs Partnership. In terms of innovation and innovative practice, I believe that the Turning Point service represents that really well. It might be helpful if I explain how the service came about. The Alcohol and Drugs Partnership commissioned a rapid review of treatment and care support services back in 2022, and what people told us, both those who need access to services, family members and those who work in services, is that there was a need for extended hours provision, a set of outreach capacity, overdose response and crisis linked to housing support. At the time we were working with housing colleagues as part of the partnership who had also evaluated their rapid rehousing transition planning with some budgets available. With that, we brought together the national missions funding and the leftover money, which wasn't enough to commission a full service, and we built a service spec that would cover all three elements. The service launched last year and over 400 people have been engaged as part of that process. We believe that the innovative elements of the service is the cooperation between housing and wider treatment and care support services to make sure that we're looking at the needs of the whole person and responding appropriately.
Okay. Oh, sorry. So over to yourselves for questions, and I suppose I'd just like to end on, I think for me as service manager of the service, I'm in a really lucky position to see the team and some of the work that they do, but as a manager as well, previously having worked with Simon Community within a residential setting, within a kind of housing area of the business, and then coming into this service, I really feel like I've got a seat under both tables, if you will. So I think the brave commissioning from this service really shows in the work that we're able to do. So thank you, and open up to questions.